Throughout my nursing career, I've spent many years teaching and facilitating learning for a variety of learners, such as pre-registration nursing students, students from overseas, return to practice nurses. However, I still feel that I have very limited knowledge around the theories of teaching, and I'm only at the novice stage of my teaching career. Healthcare is ever changing, and we are influenced by external factors, both political, the media. The nursing curriculum has to adhere to governing bodies such as the NMC. We have to follow directions from the Department of Health and now European directives as well. My main aim when teaching is to form the link between the theory and practice, and my teaching must be based on evidence and research. There are key elements in nursing. Individuals need to be caring with good, effective communication skills. Our nurses must have autonomy, and they must be self-aware and prepared to make sometimes very difficult clinical decisions, which are always based on evidence. They must have the clinical skills and the underpinning knowledge to care for our patients. At this moment in time, I consider my philosophy to be humanistic. My role as an educator is to encourage and bring some enthusiasm and motivation to my students. Carl Rogers in 1993 did bring about this concept about student-centred approaches. For nurses, I feel that this is something that we do all the time, and we often, we have to put the patient at the centre. William Glasser in 1996 suggests that learners need to have a sense of belonging and that they need to have fun, and I totally agree with that. I really feel that that's how you remember a really good lecture, is when you've enjoyed it, you've had fun and you've participated. Some of the teaching methods that I currently use: role play. We use case studies to explain what we want to get across, our messages. We also use simulation. And I do feel that the learners, when they're interactive, they're having fun and they definitely learn more. I do follow, I like to feel that I follow David Kolb's experiential learning cycle, and basically, doing, practicing, and then coming full circle round as to why we're doing it, how we do it, and reflecting, that they have to reflect on what went well and what didn't go so well. Up until now, I've been in quite a privileged situation. I've been able to teach what I want to teach, which is really lucky, I know. So I've always picked subjects that I'm quite passionate about, that I actually have knowledge about. What's going to really stretch me and get me outside my comfort zone is what we're looking at now, is for me to choose subjects, but things that perhaps I'm not very comfortable with. And I think that for me, it is going to be quite difficult. I've been observing lots of colleagues, and I've definitely seen those that have a passion for their subject and how that's really come across to the students, and they've gone away feeling enthusiastic about their placements, about what's coming up and about their learning. At this stage of my learning, I have to question for myself, I do feel my philosophy is humanistic, or is it because I choose subjects that I can allow that to be my philosophy, if that makes sense? I think it's another comfort zone. Let's all have fun. Let's have literature and let's have fun. But I do accept that maybe this isn't always the right way, or maybe I'm just choosing these subjects that allows me to have this way, and what a wonderful privilege that is. I need to learn. I'm at the beginning. I know that I need to learn new techniques and strategies to ensure that I can deliver a much wider range of subjects. This, for me, is a massive learning curve, is to put myself on a video camera. Horrendous. I've hid myself away in my kitchen, and maybe because this is a more comfortable zone for me to do it in, but it still is for me horrendous to see my face on that screen. Thank you. Goodbye.